Sean Sullivan here with Tanya Khan from Alston & Bird's digital health team to discuss Remote Therapeutic Monitoring, or RTM, which is a new set of reimbursable healthcare services that CMS just made available as of January 1st, 2022.
Sean and I discussed the RTM codes when they were first proposed by CMS back in July 2021. Since then, they've been finalized in the 2022 physician fee schedule. The RTM codes differ from remote physiologic monitoring, or RPM codes, in that RTM is available for non-physiologic data, such as indicators around therapy and medication adherence, therapy and medication response, and pain levels. Sean, what are some other differences between these new RTM codes as finalized in the new CMS final rule and the older RPM codes that have been available for a few years now?
Well, for one, the new RTM codes are not E&M services like the RPM codes are, but rather general medicine codes. That primarily has two implications. First, unlike RPM, RTM can be ordered and delivered by physicians and other qualified healthcare professionals, which includes physical therapists, occupational therapists, speech language pathologists, clinical social workers, and certain other professionals. Although in the proposed rule, CMS had initially questioned whether these other professionals would be able to bill RTM codes due to a concern that the code structure implicated Incident 2 services, thereby excluding therapists and other professionals without an Incident 2 benefit under Medicare. But CMS confirmed in the final rule that RTM is in fact available to them. Second, RTM cannot be provided by clinical staff under general supervision using Incident 2 billing. Instead, they need to be performed directly by the billing practitioner or under direct supervision incident to the services of a physician or non-physician practitioner, like an NP or PA, or by a therapy assistant under the supervision of a PT or OT.
That's right, Sean. And this requirement for direct physician supervision instead of general supervision does somewhat limit the use of RTM for Incident 2 services. Another limitation is that although the type of data being monitored is broader in the sense that it's not restricted to physiologic data like it is for RPM codes, it's also narrower in that it must pertain to the musculoskeletal system or respiratory system, whereas RPM codes are broader from a clinical or biological system perspective. But these new codes still open a lot of opportunities for practitioners and other qualified healthcare professionals and their patients, especially therapists like PTs and OTs, like you said, who now have the ability to, for example, monitor when their patients are doing their prescribed exercises at home and their progress, and to actually get reimbursed for doing that. Like RPM, it still requires a medical device, but that can be as simple as a smartphone app. And unlike RPM, the RTM data can even be self-reported and manually entered by the patient instead of having to be automatically digitally uploaded by the device.
That's great, Tanya. And we've already been seeing providers and companies in the healthcare industry start to figure out novel ways to use these new RTM codes, which not only open up new revenue streams, but also ultimately benefit patients who get better quality of care as a result of these new services and the monitoring by their practitioners.
For RTM reimbursement questions or legal assistance with any digital health matters, please feel free to reach out to Sean, myself, or any Alston & Bird healthcare attorney. Thanks so much for joining us.